But now, all she has to do is pay for her, or we'll do Isabel, okay? What did we say, $20,000? If she pays $5,000, we'll pay $15,000. So she's still paying. She's contributing, so that's a capitalist model, okay? She's making her contribution based on her own ability to pay, okay?
This 120 was for what percent?
There's a number, federal poverty level. So if it's something like $20,000 a year. If your income is less than $20,000 a year as a single person, I think for a family, it's maybe, I don't know, it's like 30,000 or something. Yeah, okay. So if you make more than that, then so 120,000 would be what? $36,000 a year. So if you make less than $36,000 a year, you're eligible for Medicaid. If you make more, you're not. But then you can buy into the reform.
It's $12,000 for individuals, $16,000 for a family of two, $20,000 for a family of three.
So that's pretty poor in the United States, right?
But this is, I mean, the tricky part about the federal poverty level is that it's federal, and so someone living in Eastern Kentucky or small-town Kentucky versus Sales, Kentucky, where I grew up, is much different than someone living in New York City or San Francisco or Boston, and that's, I mean, a lot of that is so political, why they won't change that.
Just state.
Okay, so now let's get,
To like state level?
Yeah, like Mitch McConnell is one of the big people that won't change that,
Right.
because he wants Kentucky to stay looking poor.
okay, so we're gonna finish in a minute here with this piece, and then I wanna just go over a little more with the US healthcare system. So what happens? Obamacare is created, taxes go up, poor people are getting something for nothing. What does that do in a capitalist society? Produces a revolt. Okay? The big T gets elected. Okay? Right? And what does he want to do? He doesn't care about poor people. All right? He doesn't care about insurance reform. I didn't say that part of the Obama Affordable Care Act, induced experimentation, both in payment mechanisms and in quality. There are a lot of interesting things that the Affordable Care Act was promoting, okay, that did not relate to insurance reform. All right? So what does Trump want to do? He wants to lower costs. It's ironic because many people who voted for him are in this group.
Don't get me started.
Okay, right?
So we do.
Okay, but they voted for him anyway.
We have the same problem.
Yeah, yes, I know. Okay? So what's going to happen now is purely a political question. Right? So we'll see. I don't need to talk about what the future's going to look like because I don't know. Okay?
I'm going to ask you some political questions because something I don't understand. Maybe you can explain it. The problem with the United States, with the healthcare system, from what I see, to be very, very general, is that everything, and I will show that in comparison with France, everything costs 3-4 times than in France.
Yes.
In the US.
Yes.
So that's the problem. The problem is that every single thing costs much more. And the reason for that is because somebody is making a lot of money out of this business.
Yes. Yes.
In order to solve that problem, you need to make the cost of the same problem in the United States look similar as in Europe. And that means that if somebody makes a lot of money, now he's going to make less.
Yes.
This is not the right way to solve the problem. Doing this thing, tax the people, is going to keep this difference, maybe expand it even more. And it's not, I would expect smart nation as the United States to identify the problem and try to approach it in a more correct way than just increasing the taxes and subsidize the insurance.
Yes.
Why didn't
So-
that happen?
So the primary politics, okay? The primary motivation for the Affordable Care Act was to deal with the uninsured, not to reform the healthcare system. And I erased it already, but, I had experiment down there. There are models, I mean, they haven't changed this, and people are probably not gonna change this part of the Affordable Care Act, okay? The Republicans probably will leave it intact, the experimentation. And in that experimentation, there are many, many cost models that they're trying to do. This is a whole different thing to talk about. But there are models where, if you read in the United States, and I don't recommend it necessarily because it's a huge headache, okay? There are organizations being formed called accountable care organizations. And what you say to Rambam Hospital is, we will give you, what's the budget at Rambam? Total?
Probably 1 billion
$1
Israeli
billion.
shekel a
Yeah.
year.
Yeah, okay. So that's $250 million, right?
Yeah.
And I know from other experiences, I have a Itzhak who said, Sheba, Sheba runs for similar, maybe more, but I mean, maybe it's $1.5 billion or whatever it is. This budget is less than the hospital system that Mesa worked in. Much less, okay, right? So now, if we say to you, we will give you $250 million or 1 billion shekels here. And whatever savings you create by improving systems of care, you keep the money. You, not only the hospital, but the doctors, the nurses, the administrators, everyone gets to share that, okay? This is what the accountable care organizations are.
I'm just curious, are the hospitals here for profit or not for profit?
Not for profit,
Yeah.
government owned,
Yes, okay.
almost all.
But this also means that if the hospital wants to make if there's a deficit, the hospital would compensate.
That's correct, that's right. So,
So they will try to
These-
save as much as possible, and this could be, if it's something political,
right,
it could be
So
on the cost
now-
of healthcare.
I'm bringing my child to the ENT doctor, and I say, my friend tells me that I need tubes. And the ENT doctor says, no, you don't. Why? Because it's going to cost him money. He's going to make less money if he puts those tubes in my ears. Now, one of the basic principles of this is the use of evidence-based medicine or evidence-based practice, same thing. So you take the research, you don't use, this is my idea, instead you base it on the research, and the research would suggest that costs will go down substantially. We do so much unnecessary care, especially in the United States.
Sorry, back to my question. Isn't there like the three, there's the not-for-profit, for-profit, and then government?
Yeah,
So here you said they were not-for-profit?
they're government.
They're government. Okay.
But there is a private practice inside the government hospitals. There is.
Yeah,
The
so-
whole Hadassah.
Yeah.
I
Yeah,
made it
it's
much
a
simpler.
two-sided
than this.
system.
Okay.
So, maybe then,
The hospitals are owned by the government.
okay.
The doctors have 3 sources of income.
So the doctors, are they, like, I know in the States, like, there's doctors that are, they don't work for the hospital, they get paid like by the hospital, but they're not actual like employees of the hospital? Is that the same here?
So,
There is a practice.
here it's a very interesting system.
Sorry if this is
Yeah.
like
No,
too,
no,
I was very curious.
Here, hospitals like in your system are not considered real hospitals in Israel. Because it's rent a room and do whatever you want to do in this room.
Okay.
Hospital is the real hospital, like Mass General in the United States. So you got your employees, your doctors, and everything. But the doctors can work after 3 o'clock. They can work in your hospital, which is they rent a room and they do whatever they want in this room, and they and they increase their salary. So, you know, the hospital as an employee reduces the cost of salaries to the doctors by telling them after hours work in a private clinic.
Got it.
Actually, the government is doing that. You know, they don't want to pay high salaries to doctors, so they say, we will be one place of your work, half of the job, and the second job in a private, and you make money, and actually you have benefits from working in a university hospital. You get insurance, you actually, a lot of doctors take advantage of that, and they move patients from the government hospital to the private clinic. They select the patients,
Because government.
and they make use of the doc. So it's profitable for the physician
Okay,
to do that.
thank you.
Okay,
Can I ask
So-
a question, please?
yeah,
About Obamacare.
yeah.
I'm only assuming that these 10% who went into the Medicare, I assume that these are people who are undermanaged and have a lot of medical issues, and we also know that anyone who is included in the insurance or in the healthcare would, as he suggested, would use the system more. Was it up to the expectations? I mean, the budget, the increase in the cost, or was
So,
it because I do believe I don't know if it was really what they expected is what they got.
yeah, so the simple answer is yes, they expected it and they got it. Now, this is seen through a liberal's eyes who supported the Affordable Care Act, which is very flawed. There are all sorts of things wrong with it, but it was the best they could do politically. Obama thought. I think he could have done it, but that's just, we can talk about that some other time. The research, there's been research over the 7 years or whatever, 5 years, whatever it is. More people who were sick sought care, they got care, and it was relatively less expensive, and they're relatively healthier. So it worked.
So Obamacare did not affect those who were primarily insured. or-
Yes, that's correct.
It
So
did
all
not.
the people who voted against it did not benefit from it,
Mhm.
nor did they suffer from it. They had nothing to do with it, except their taxes went up.
But what about the fact that insurance companies would do a lot of paperwork and ask a lot of questions, and if someone is inflicted with the disease or something, they would not
This did
insure
not,
them?
the Affordable Care Act did not change, did not increase the burden for the insurance industry. All it did was add more people, and they made more profits. Today, the insurance industries are opposing, the insurance industry in the United States is opposing Trump. They want it to stay this way. Okay, now, when I was in Ohio, I created an organization at the medical school called Health Systems Management. That was the name of my unit. Okay, I was the director of the unit of Health Systems Management. And I came to realize it's a double oxymoron in the United States. There are no health systems, and there's no management. Okay? And this, I just want to make this point. So you're a doctor's office, you're a little system in the United States. You're your own business. And you send somebody to a lab for testing, blood test. They're a business, okay? And then they have to go for an x-ray, and they're a business. And each of these is a business, you know, they're a system. There are employees, there's the boss, there's a whole system there, right? Then they need to go to a consultant, that's a separate business, and they have to go to the hospital, that's a business, okay? So in the United States, there are systems, but they're so disunified that from a macro perspective, there is no health system. There are small micro systems, but there is no health system in the United States. And as we're going to see in many other countries, there is. We're going to learn about Sweden soon, and Sweden has a health system. The United States really doesn't. Okay? So let's just go through a few more points to make sure I didn't miss some things that I wanted to say. Okay. Autonomy, part of the American way. multifaceted, privatized, capitalist model, complicated by a moral hazard problem. So that we already said. We've talked about this, that about the government basically supports about 50% of the cost for healthcare. One of the points that I didn't talk about are out-of-pocket expenses, and as you study your the healthcare in your country that you're going to present, out-of-pocket expenses will vary quite a lot. What are out-of-pocket expenses?
The patient pays.
Yeah, patient pays.
Okay.
Okay, right? So in Israel, there are out-of-pocket expenses relatively high. In the United States, they're very high. In Sweden, they are basically zero. We're going to hear about it, okay? We talked about how the uninsured dropped and how money motivates almost everything in the United States.
Question, please. Question. In the United States, for the out-of-pocket, is it for those who are not employed, that they don't have insurance?
Even those who are employed.
You can decide and say, I don't want my salary to be covered for insurance.
Yeah. Wait, ask that again, I'm sorry.
I'm asking, I first asked if those who pay out of pocket are those who do not work.
Those who do not work pay out of pocket, but those who do work have significant costs that they have to pay.
Why is it that the insurance where they work don't pay for?
They don't pay for everything. Why? Because it's an incentive for me not to ask for the care. So I go to the ENT doctor, and he says, we're going to put tubes in your child's ears. The cost is $800. You have to pay the first $250. Well, then maybe I don't want to pay. Okay. Plus, it lowers the cost to my employer because I'm paying the first $250. Okay. Yeah, we've really talked about this. Okay, so now, where are we today in the United States? I picked that picture, Oh, God. Okay, so what do they want to do? I'm saying Back to the Future, if anybody remembers that movie. Reduce government costs of healthcare. There's no real interest in reducing overall costs of healthcare. That's not part of what they're talking about with healthcare reform right now. They do want to lower taxes. The rich will get richer, the poor will get poorer.
Why it's number 2? Why they don't want to reduce? That's lobbyists of the insurance company, drug companies, doctors, whatever.
Political philosophy. The government should not be involved in determining the cost of anything, okay, including healthcare. So their belief is that government should just get out of the healthcare altogether. So they don't care what happens to healthcare. They just care what they're paying for. They meaning the government.
I remember when saying.
Let the marketplace determine what happens, is what they're saying.
So they didn't figure out that health is not part of the free market.
That's correct.
It was one of his assistants who said people should walk more and exercise more and get sick less than.
Yes, people should get sick less.
No, but he actually thinks that exercise kills you faster.
Yes, he does. University. Yeah. Okay. They want to reduce insurance coverage, which then would bring up the uninsured up to about 15%. This is a very complicated thing for those of you who are not Americans, not U.S., excuse me. Okay. Canadians are kind of similar, I think, with this. In Canada, there are provinces. In the United States, there are states. Each state has its own government, its own laws. They highly regulate what happens at the state level. So I am a licensed physician in the United States. I'm not licensed by the United States. I'm licensed by the state of Georgia and the state of Ohio. And the two licensing processes are not quite the same. Okay? Most of the laws that I live by in the United States are state laws. They're not federal. Okay? So in the United States, there's this whole argument about should the states have rights or should the federal government have rights? Big conflict. And then finally, part of what Trump Care is all about is reducing abortions, eliminating contraception. I'm being a little exaggerated, but not much. In the Affordable Care Act, what Obamacare, they required that insurance coverage include the cost of contraception, the issue for women. And that is, they're proposing that that be eliminated. That women will have to pay for contraceptive costs out of pocket. And then all of women's health services are threatened. Now, this is a political view, my political view.
Does that one include the maternity costs for women?
I'm not sure what they'll do. I'm sure that they want to reduce their contribution to maternity costs for women. Yeah, I mean, it's a great irony, right? They don't want abortions, but they don't want to pay for deliveries either.
Yeah.
And they don't want to pay for contraception. Okay, now, I think, let me just look at where we are. So let's take a 10-minute break. We're going to go over a couple other things. Then Ariel's going to do Sweden. Okay? So,
When do I do France?
you do France right after lunch. Okay? You here?
I'm ready.
Yeah, okay. All right, so let's say 5-minute break. Just get up, run around, and let's come back.
אפרופו המורל הזאת שלך והמכונית, התכתבתי עם גילה וביקשתי ממנה אישור כניסה לשבועיים, אז היא ביקשה את התאריכים, אז נראה לי ששווה לפנות אליה כדי להכניס את הרכב. כן.
Barbara was, I was telling her about this. Do you have a form?
I think that one person that just keeps going
Yeah, listen, it's not a lifetime. I'm not saying it's bad.
But she's like, you know,
Yeah, that's what I
Resilient.
Yeah, because I have read that the small, there was Canada.
You know, I think his.
GASS. GASS. AS. GASS. UNIV or University.
Actually, I'm gonna make that question that you just said.
נקודה חיפה.
It's,
Okay, don't worry about it, I won't tell anyone.
5 a.m.
Quiet.
right?
נקודה
So
חיפה.
he probably left, midnight. So he's flying.
Yeah. Oh, no, I'm not, it's fine, I just wanted
But
to.
once he gets, yeah, no,
Yeah.
that's good. And once, he says, once he gets back to Copenhagen, then he's gonna get back into doing things. Actually, he was doing some stuff. So, yeah, good. Well, that's
No, yeah, I'll send you both
Good,
email, let you know
congratulations.
about that, so.
good. I understand why.
It's just, oh, thanks.
So, but that's good.
Yeah. Yes.
In fact, I do feel like a lot better.
Yeah, now you've got, I mean, you know, you
I
need.
got something to keep me here,
Yes.
I don't have to go back to the States, thank
Good.
God. I'm really happy about that.
I'll trade you, Mesa, anytime.
Are you going back?
No,
Oh,
I'm
okay.
just telling you, if you'd like an excuse to stay here, you can have my boyfriend whenever you want. Borrow him. You need an excuse.
Richard, can I ask you a question? I remember, I think there was another course we read a piece by Fu Gawanda in the New Yorker. I think it was about a small, it started out by
The
realizing.
city of,
Yeah, something Texas.
it's
Yeah.
Texas.
Right. So it had to do with the fact that a lot of physicians are owning laboratories, no regulation against that whatsoever. I mean, you know, talk about moral hazard, flip side.
on the physician side, you know, obviously there's a moral hazard there.
You know what, we can turn this off for a minute. Not that I'm trying to,
Yeah, no, my US physician friends will be mad at what I just said, but.
yeah. Okay, so